Hi, and welcome to Morgellons discussion and microscopy videos. I'm your host, Jeremy Murphy, and today we have an extremely special guest on the show with us today, Dr. Courtney Day. Not only is she a Morgellons patient, but she's a doctor, a practitioner, a physician. So Dr. Day is going to be discussing with us Morgellons, and that's what she'd like to do is build a practice helping Morgellons patients. Hey, Dr. Day, how are you doing this evening?
Hi, Jeremy. Thank you for having me. It's a pleasure to be joining you tonight.
Yeah, this is a great night too. The whole week has been it's been real pretty with spring creeping in.
Yeah, I don't know how it is where you are, but here on the West Coast, it's been fantastic. We have early spring weather. Yep.
Yeah, much of the same over here also. Um, Dr. Day, can you tell us about the history of your interest in medicine and what led you to specialize in Lyme disease and Morgellons specifically?
Oh, well, for many practitioners that I've now met that are in this field, my journey was very personal. So, although I always had an interest in medicine and went to school and was connected with a bunch of microbiologists at the time, who, when I showed them my unusual symptoms, they looked at me with bewilderment and asked me more questions than they had answers for me. It really made me realize that, oh, maybe I should go back to school and see if I can find any doctors who can help me. And at that point, there wasn't very many doctors who were treating Morgellons or any. This was all the way back when I was around like.
Sorry about the technical difficulties, everybody. They must have a lot of network traffic at this hour. Dr. Day, please continue.
Okay, should we give it a little bit of time for people to log back in, or I don't know if you can see that right from your end.
I see Elizabeth Jennings is tuned in. Hey, Elizabeth, how are you doing this evening?
Okay. Yeah, so where did we leave off? Took my mom aside. Actually, I didn't know at that time, but took her aside and let her know how high the suicide rate was for his patient load, and convinced her that it was really important that I go home and be with my family, and take a leave from my job at the time. So I remember it being very shocking recommendation that was given to me, because I think there was other circumstances in my environment that were really triggering symptoms.
Well, I mean, just the stress of going through school, I'm sure, was a lot, right?
Oh, I'm sure. Yeah. Hard to remember it now. It seems like it's so long ago. Yeah, I think it was maybe more stressful to go through my undergraduate program than medical school, but at the same time, I was also struggling with an undiagnosed chronic illness. So, makes more sense. And that's actually how my symptoms really started initially, was not just with skin symptoms, but just massive brain fog and cognitive symptoms that were alerting to me, and alerting enough to the pathologist that was why he was like, she needs to go home and take a break from everything. And,
oh, wow.
Yeah. So.
Yeah, that's hard to deal with when you're trying to go through school and and you can't recall things quickly, and you know. But you went through it twice. You said you went as a microbiologist, and then again for your training as a doctor.
Yeah, my journey was a long one through this illness, with recovery and relapses. So I learned a lot through Morgellons disease, and Lyme disease really is. I think that right now it somewhat lacks a clear definition, although they're giving a good effort to define it. I can see why the definition is different in different patients' minds who've been through this. Because I've defined it differently throughout my journey. I remember when I was first diagnosed and they told me about how it was linked to delusions of parasitosis, my first question was, wait, do I have a parasite? Because I
but the definition really, the more clear cut it is, and the better ability I feel like we have to rule it out. What
Mhm.
about your methodology? How do you approach treating your patients and starting the investigation to find out what's afflicting them personally?
Well, going back to the definition of Morgellons, really, I don't know of very many other diseases that will cause filaments to extrude from lesions or this intact skin. So I try to counsel my patients on how you can visualize the filaments and fibers that have been associated with Morgellons, and that how you need to look with microscopy. And this is one of the mistakes that dermatologists.
In my particular case, my doctor found evidence of relapsing fever. And for me, that made sense. Not necessarily that it was a spirochete, but I mean, like every few weeks, I would relapse into like an extreme fever, and I'd have all sorts of problems. And yeah, and but then I learned a little bit more that, hey, this is just like Lyme disease. Is that what you find, that a lot of patients, maybe they don't have Lyme disease, but they have something else like relapsing fever?
Yeah, or sometimes I find they have mixed borreliosis, both showing up positive for Borrelia burgdorferi and a relapsing fever strain. And some of my patients don't test positive for, or it's questionable whether they're testing for tick-borne relapsing fever or louse-borne relapsing fever. That has come up on some of the labs. And that would have a different vector, spread by lice and fleas. So similar to Bartonella. And I know that's always questioned because Bartonella is thrown into this whole mix of infections, but it's technically not a tick-borne infection. Certain types of flies can spread Bartonella, and that's really what caught my attention. Was I was seeing more cases of patients complaining that they had flies in their home and lots of infestation, or even fly larvae in their skin. So it was really brought to my attention by a couple patients within 1 week, which was really stood out in my mind, how much they had symptoms that were resembling myiasis. And in those patients, I was able to actually get fly larvae and flies, adult flies, sent to Texas A&M for identification. So they
Oh,
were
good.
unusual small fly species that occasionally cause an opportunistic myiasis. So that stood out to me because of the historical link to Morgellons and myiasis in England and France.
Wow. Wow, that is pretty important. About would you feel free to say about what percentage of patients you encounter that experience myiasis?
I think it's a smaller percentage, and to be honest, I really don't know. Um, it came to my radar later in the game, so now I ask more about it. And some patients, it's questionable, like they see these flies around their home or question whether or not they're coming from them. But other patients, just it's very obvious.
Yeah.
And other clinicians have even noted on physical exam that they have extreme amounts of inflammation in areas. If they don't see the actual signs of myiasis, they can at least document the pathology that's happening in the area.
Wow. Yeah. Can you explain what myiasis is, just for people who aren't aware?
Um, Myiasis would be an infection with fly larvae, and there's different types. So we typically think of bot fly larvae as clinicians, as that would be the more common type that you would see associated with travelers usually, although
Wow.
there's some people who acquire it in the United States. I did see a patient who came up to me from the San Diego area with a bot fly larva. But those ones are usually very localized in the skin, and without treatment, they'll usually come out on their own. Really, what needs to be treated more is the secondary infections.
Yeah.
But for these other patients, they had more of a creeping or crawling type of myiasis that affected not only the skin but seemed to migrate to other areas. So
Oh no.
it matched actually when I dug up some of the case reports from the 1940s. It did match some of the cases. They were just really hard to find because the case series is on PubMed, but the cases themselves, I had to do some further digging to actually find them.
And so myiasis can cause skin lesions, right?
It can. There's a cutaneous form,
Wow.
as well as a migratory form. So it really kind of depends on the fly species, exactly what type of symptoms it could present with and what area was affected.
Oh wow. What about stress? You know, both just not just physical stress, you know, working out too much and stuff, but also emotional stress, going through really tough times. Do you feel like that really impacts a patient and their ability to manage Morgellons?
Yes. I think that's one of the main factors that I'll see on a patient's intake when I ask them what happened currently or around the same time that you got sick. Um, Often I'll see indications of a large stressor that either like a divorce or death or something like that of a close family member or spouse. Um, some of the things that are known to bring down the immune system. So it makes sense to me that there could be a link there with stress and Morgellons.
But and as you know, Morgellons patients may be less likely to open up about what's going on in their life because we might be afraid that we'd be diagnosed as causing our own skin affliction, and that's the worst thing to go through when you're going through a stressful time in your life.
Exactly. And even just having the disease itself can be very stressful, especially if you don't have family member support or friends supporting you. Which sometimes people don't have any social support system through this. Very challenging.
I think that's why people like the social media because it gives them an environment to be a part of that community. And in that regard, I really think that it did help getting online and participating in these groups. But in a lot of times, you know, people go astray in these groups with like strange therapies and even unproven ideas about Morgellons. But what about medical marijuana? Do you think there's a place for marijuana in treating Morgellons, and how does that work?
Sorry, you can hear I have dogs and one opened the door on me.
That's awesome.
So they might bust in here any second.
Well, we'll start getting more viewers if that happens, I'm sure.
As far as your questions, you're right about the forums. They can be very helpful, but then also, yeah, just like social media in general, there can be a lot of negativity and downsides to it. And you can see the frustration there from patients and some of the agendas. You wonder what these people are up to who are kicking people out of groups for asking good questions or commenting. So
Yeah. Personally, I believe it boils down to money, but you know, I guess that will be seen
yeah,
eventually.
and then your question about medical marijuana.
Yeah, thank you.
Yeah, it's funny because even though am a naturopathic doctor, we didn't get medical marijuana prescription rights until later on in my clinical practice. So in the last few years, we've had them, but and there are ways that you can use the medicine that I think are more toxic than others. So I try to counsel patients around that. If they are going to be using medical marijuana, how to do that in a way that's not going to be detrimental for their health, but more helpful. And then some of my patients do well with just CBD only. So not everyone can benefit from just CBD, but that will take away some of the toxicity aspects.
Yeah, you can have a negative experience with marijuana, and what I've always heard is start low and go slow. Start with the CBD and then maybe titrate up to 0.3% CBD THC and then 1%, and then if you feel comfortable with that, go from there.
Right. Yeah, but I'm seeing reports of CBD toxicity now, even that surprised me initially. So,
Yeah, one of the problems is specific from what I understand. I work with
mhm.
a nonprofit on the marijuana. The if you full spectrum is especially important. You can take the isolate too much, and without the other compounds in it, it won't evenly work out throughout the body, and it can make some symptoms work. Like it can cause liver damage in one case I saw.
Well, it makes sense. It's usually has to do with the dose and how it's delivered when it comes to those situations. And sometimes it's patient dependent.
Yeah.
Yeah, paper on how to cure plasmids from bacteria.
What?
So spirochetes, like Lyme disease or Borrelia, most of their genes are located on plasmids. So one of the interesting things about cannabinoids are they do use cannabinoids to cure plasmids in the lab. Um, I don't know if anybody's done this study clinically. Actually, I don't think they have, but it's always crossed my mind that, hey, maybe that's one of the reasons why patients could also benefit. I think
Patients should like totally avoid.
there are definitely things I question, and some of the things are popular. So I know I might get some people like disagreeing with me, but like the NIH, for example, and the toxicologist I first saw had some concerns with using silver as a treatment, especially in certain doses. And
Yeah, the diet.
okay, so for diet, what I noticed for myself was that when I started going to national university, whether or not I had celiac disease.
Wow.
So yeah, and at this point, I don't think that I have true celiac disease. It seems like once my gut recovered, I was able to introduce gluten back into my diet. Although I do have gluten sensitivity in my family and predispositions genetically. So yeah, that's made a huge difference for my whole family, actually. Once I learned that I was sensitive to gluten,
Okay.
more and more family members. First generation of doctors, but my grandmother was a nurse,
Oh, wow.
and um, my mom was an educator for new parents, actually, for Stanford Hospital. So
Wow.
definitely in the family.
Yeah, that's some credentials right there. What regarding genetic testing, is that beneficial or is it just wasting money to
What kind of genetic testing you mean for celiac disease, or?
Oh, well, I mean, just those, you know how you can get the 23andMe and then you can plug them into all these other health websites uh, and then get some results there. Do you feel like patients really need that data? Is it going to help them? Or do you think that you would be the best person to interpret those genetic results and determine what kind of direction to go from there?
Oh, that's a good question. It's interesting you asked that. Part of my background when I was in medical school, my brother was really interested in learning about genetic information about our health. So we founded 23andMe. I'm sorry, not we met the founder of 23andMe and talked to her about our ideas. And that was what really led us to launch geneticgenie.org, which I think was one of the first free methylation genetic websites that could use your 23andMe raw data to go through and analyze the SNPs. Um, And so that was really fun to like be at the very start of that and see where it's gone from there. So I remember being in shock when I was in my genetics class in medical school and all of a sudden they're mentioning our website in one of the slides. I'm like, no way, this is making it into my using that knowledge clinically. But at the same time, it was also really disappointing because really what I learned through a lot of it and our goal for doing it was to see if there's ways to optimize. My brother at the time was having really strange reactions to things like glutathione and B12 and
Oh, wow.
It did make sense of some of those reactions. But in the long run, it was really treating some of his infections like Lyme and babesiosis that was the founder of that website.
Very cool.
Yeah, it was really him collaborating with a bunch of sick patients that just wanted to try to figure out and see if there's any way to take information and data and make some sense of it. So I remember being somewhat scared early. It was so early on, and I'm like, are we even making any sense? Is this even a real field? But it's neat to see where it's gone.
Yeah, it's legit. So if you get a genetic test online, don't change your lifestyle right away. Maybe share it with your doctor and see if they have any thoughts on it.
Definitely. And there's more doctors who are ordering those types of panels and able to analyze them with their patients now. So
Some good training out there too nowadays.
yeah.
The you have to do a lot of CE up there in Oregon.
We do. Say,
So I mean, you got people that are homeless out there. They can't really get into a place where they can even feel safe. I mean, that's got to be stressful, and all the exposure to the elements out there, the insects, and
right.
yeah.
So I hear from patients in those situations all the way to patients who are really well off. And so this is not a disease that discriminates at all. It can affect anyone. And maybe there's some genetic predispositions to who tends to get affected more than others, or environmental factors or predisposing factors. But the challenge is to even just get a doctor or even sometimes family members to accept or believe what's going on. I've seen some patients who are like at the point of almost completely breaking down.
That can weigh on you. And on the other end of the spectrum, though, and you got to be real strong to be able to, provide that kind of comfort. On the other end of the spectrum, have you ever observed a patient who mistakenly believed they had Morgellons? They thought they had Morgellons for sure, but when you looked at their skin, it just wasn't evident.
I have definitely questioned some of the cases, especially when I'm in virtual practice now and I can't do as much physical exam and microscopy personally myself. I'm sometimes rely on patients to send me pictures or send me things that they have and have to walk them through on how to do that. So that's been so much more challenging now, as you can probably imagine. But even when I could see patients in office, they're not always currently active in their symptoms, right? Or they don't currently have sometimes something to exam to confirm it. And I remember this one patient in particular that I think there was something really going on with him that a doctor in India was actually able to help him with some of the agents that we don't have here in America. Because of the fact that he was trying to just communicate as best as he could, but was struggling to do so much that, for example, he had things that looked like sticks coming out of his feet. So he wanted to show me that, but he couldn't at the time. And so he went to patients with really advanced disease where they do have what looks like sticks coming out and matter. what looks like plant matter coming out of their skin.
Yeah.
And sometimes patients show me, and I've experienced this myself, where the plants or the matter seems to be the same as the plants and matter in the environment. So it's almost like the skin is like sucking it in somehow and hyperabsorbent.
That's right.
And so that part was really confusing to me. I remember that particular case. And I remember just suggesting, can you go back to India? Because whatever you were seeing in India, I think they might have understood what's going on here more than I do. And that's really where I've struggled, is really where I've seen patients who are from other countries where they do have advanced parasites.
Symptoms that are associated with Morgellons. It's not necessarily that the microscopic fibers in the skin are the only symptom. Because I have seen something like with twigs coming out of people's skin, or a thing that looked like a cocoon, like a snail shell. I've seen that before, and they are legit. But it's hard to, it's hard to say, okay, that's legitimate, definitely. But let's see if we use a microscope on the skin, if you have these really, really microscopic fibers. And so we did write a guide on that. I'll put a link in the description below. And Dr. Day, you do a great job kind of guiding patients through this whole experience, this traumatic experience.
It is a very traumatic experience. And to be honest, it's traumatizing sometimes just as a physician to try to help patients through this. And I have been so challenged at certain points in my career that sometimes I'm like, I just can't go on. I can't do this another day, especially when patients get questioned about their children. And I've seen a few patients now who've been accused of Munchausen syndrome. And luckily, they've been able to defend themselves. But that has been the most heartbreaking part of this, helping patients through this journey, is when they're being questioned to the point where their whole life is being ripped into shreds. Hurt the patient's case. So that's really where I've been having the most challenging cases of where I can't sleep at night. So how do I make sure this patient is believed to the point where they don't lose their family?
Wow. So they don't lose their family. Thank you for sharing that, for that experience with us. What is Leishmaniasis? People want to know about this parasite, and this is something we learned about in parasite class, but you have a lot of experience with that, right? Is that associated with myiasis?
Perhaps. So the interesting thing was that the species of fly that came back in my patients with myiasis was a species that was known to spread Leishmaniasis. So talking to the entomologists, they thought it would be very much geographically related to the likelihood of the vector spreading Leishmaniasis, but
so it was the Leishmaniasis treatment that actually brought that patient around.
Yeah, and I mean the treatment, if the patient had Leishmaniasis, talking to the CEO of the drug company, the patient would most likely need that treatment. Like, it would be hard for them to recover without it, just from his experience so far. But at the same time, I'm not completely convinced that we were treating Leishmaniasis. It's possible that the drug helped with some other infection, or just helped the immune system enough to recover. And it's such an expensive drug that you can't get it easily prescribed for most patients. But it could follow you, because it seemed to infest her brand new apartment, and only her apartment on the 8th floor, no other apartment. And then once she recovered enough, she moved back into her home, restored her relationship with her husband. She said they had a better relationship than they ever had before, and felt well enough to return to full-time work.
That's cool. That's a success story is what that is.
Yeah.
Wow. Well, thank you for sharing that. I hope that it encourages people. Wendy O in the chat saying that she would like to come see you. and is in Oregon. So yeah, if you'd like to see Dr. Day, I mean, she would love to see Morgellons patients specifically. Can you do you have any pets?
I have
I
lots
think
of
we just answered that earlier. Yeah.
yeah. I think that's actually maybe how the myiasis follows, and I use them as ways to try to figure out not only how to help my people, but then also my patients' pets as well. So I figured out some good regimens for my pets that have been helping to prevent them from getting tick-borne illness. And my dog, Summer, who's the oldest, seems to be keeping her healthier than she was before. So that's been cool to see too, is how not only can we use this knowledge, and I learned through adopting some cats in this town that we definitely have a problem with fleas.
Oh no.
So was not
Yeah.
able to adopt a cat without having to do further flea treatment on that cat. That's what I learned.
So to be, and also just to, you can get Bartonella from fleas potentially, right?
Yeah. So that's always one of the arguments against the diagnosis of Bartonella in a Lyme patient, is that, oh, but that's not a tick-borne infection. It's usually from
Oh,
fleas, or more likely from cat scratches. But I do see it more common, it seems like, in patients that have cats. It was just actually recently published that kids who own cats seem to be struggling as far as chronic infections and neurological symptoms.
wow. Yeah, and you can't treat a bacterial infection with antipsychotics, right?
Oh, well, that's questionable. Some of the antipsychotics do have antibacterial and antiparasitic actions. So that's actually brought up by sometimes when I see people talking about different Morgellons treatments, is that questioning whether or not an antipsychotic is being underdiagnosed and undertreated, especially talking to the drug reps. It seems like there's not very many prescriptions being written compared to how many cases we're saying are suspected.
Yeah, a lot of people have cats, and that's a parasite like babesia. Does it invade blood cells, toxoplasmosis, or?
It's different. That's the one that you really want to be more concerned with for pregnant women.
Oh wow.
So the risk for fetal transmission is there, and I know some countries have questioned, like France, for example. I read a study that they were questioning the
Yeah, definitely appreciate everybody being extremely patient and hanging with us. We see that everybody's been hanging with us throughout the stream, and Dr. Day has given us, I believe, a very unique perspective on Morgellons. And hopefully, if you would like to see her, contact Dr. Day. She is practicing out of Oregon. What is the name of your practice? Daily Wellness, is that right?
Daily Wellness. Yeah, spelled like my last name, Dayly Wellness.
That's cool. That is very cool. So, last question: what do you like to do in your off time when you're not practicing medicine? It's video games, right?
No, I'm not a gamer. You might be though. I
Yeah,
think.
maybe.
I was back when I was in like middle school. I think I grew out of it. I just remember loving Duck Hunt as a little kid though.
Oh yeah.
They brought Duck Hunt back maybe. To learning how to detox. So I'm spending a lot of my time recently coming up with protocols that maybe could help patients with getting all of this stuff out. So the toxicologist that I first saw, she kind of, now thinking about it, 20 years ago told me that, you're going to have to figure out a way to get your body to start purging this, to suck. She was saying that there's certain ways you can help your body to expel and get it sucked out of your skin. Lights and sounds. And my favorite tool now is the ionic detox sweat bath. I've learned that by using different frequencies and light and even meditation techniques, getting the nervous system to relax, that I've been able to detox some things that I still don't know what they are. Sometimes I question whether or not they really came from me because they were so bizarre. But when I started various things being purged that are of different nature, so things that sometimes resemble plastics or wires, or sometimes resembled seeds or plant matter or glitter. So, and I've actually matched some of the glitter to my glitter in my craft supply. So it's been an interesting thing to do. I guess that's kind of a weird way to answer what do you do in your spare time, but
this is something that, people feel like they should be able to open up and talk to somebody who understands, and you really do understand.
yes, I can tell them if anything, I can relate and at least help you feel like you have somebody who can understand what you're going through. I don't think there's anything a person has said to me at this point now that I have scratched my head and been like, what are you talking about? For the most part, it's all really relatable. So
Just being able to talk about it. Dr. Day, we hope to have you back on the show here sometime soon. And if people want to see you, we're going to put your information in the description below. Thank you so much for doing this for us, Dr. Day.
Yeah, thank you. I really appreciate you inviting me tonight.
Yeah, definitely. We've been wanting to do this one for a long time. Hope you